Hello?
Hey, I have a new story for you. I heard about this new business in town called Home Health Heroes.
Mm-hmm.
Go see what you can find out.
All right, gotcha, boss. Hey! Wait up! Do you know anything about Home Health Heroes?
No, I have to go.
Wait! Hey, have you heard anything about Home Health Heroes?
No? What are you talking about?
Never mind.
Excuse me, do you have some toilet paper over there?
Sure.
Thanks.
Do you happen to know anything about Home Health Heroes?
No, I don't even know what you're talking about.
Oh, hey, have you heard anything about Home Health Heroes?
Actually, I have.
Home health is a unique branch of physical therapy that provides a broad range of services within the patient's home. It allows patients to receive healthcare services within the convenience of their own home while providing supportive, skilled, and safe care. Home health allows patients of all ages and wellness to receive care. Home health physical therapy is designed to benefit patients who range from senior citizens with joint replacements to children with developmental disabilities. Interventions are specifically tailored to the individual's needs and based on the individual's deficits and functional abilities. The purpose of home health is to maximize the health of individuals in order to enhance their independence, efficiency, and safety within their home and in the surrounding community. The most important characteristic of home health is the home of the patient. A home is not limited to the patient's actual house. It may refer to a family member's home, an independent living facility, a skilled nursing facility, an assisted living facility, or a group home. Providing home health therapy requires creativity and a level of care that is not seen in a typical therapy setting. Flexibility and improvisation are important characteristics of home health physical therapists due to the lack of equipment, small areas, and other complications. In order to ensure safety, home health physical therapists must understand the functional capacity of the severely ill, their comorbidities, and various medication interactions. There are many misunderstandings about home health physical therapy. Many people believe bedridden elderly adults are the only patients home health physical therapy treats. Even though the majority of home health patient loads are elderly, there are many other populations treated through home health care. Patients range from infants with developmental disabilities or genetic conditions to elderly who have experienced strokes or generalized weakness. Another common misconception about home health physical therapy is therapists spend minimal amounts of time with the actual patient. Many people believe home health therapists spend majority of their day driving around. However, just as any therapist in any setting, home health therapists still have to meet a certain productivity level. Other common misconceptions about home health include no research or evidence-based practice, home health physical therapists are not able to specialize, therapists only work with patients in their home until they can get into the clinic, and all agencies are run by nurses. With this being said, further advocacy and awareness needs to be implemented to clear up these thoughts. Home health therapy consists of many different environments and settings. Home health care may be hospital-based, independent, for-profit, or non-for-profit. However, Home Health Heroes is an independent home health care business providing individualized and skilled therapy services for children of all diagnoses. With being an independent business, we accept referrals from all sources. Home Health Heroes strives to provide skilled physical therapy services in each client's home, ensuring comfort, compassion, personalization, dedication, and excellence with every encounter. We have an experienced and educated team of healthcare professionals who are dedicated to enhancing the lives of children within the community. Home Health Heroes is recognized for its commitment to improving the health of children, providing convenient and innovative care, and delivering outstanding services benefiting the quality of life. With our passionate team of physical therapists and physical therapy assistants, we will continue to provide a wide variety of services along with a trustworthy relationship amongst professionals and clients. Home Health Heroes is operated by our executive administrator. Our executive administrator is responsible for the functioning of the business and is an important piece of the structure of our business. The executive administrator is the connection between the communication of the supervisor, director, and other staff members. We also employ a director of physical therapy within the company. The director of physical therapy is in charge of all clinical operations, including policies and procedures. Home Health Heroes also employs a supervisor who has the responsibility of scheduling, addressing customer service questions, staffing, and any related issues that may arise. A human resource manager is employed within our company to ensure the business runs efficiently and takes responsibility to ensure each hired professional is qualified and capable of his or her duties. At the home office, we will also have a receptionist available for answering phone calls, scheduling patients, and answering questions. We also employ physical therapists and physical therapy assistants since they are the front line of our business. These employees are directly responsible for patient care. We employ 5 licensed physical therapists and 2 physical therapy assistants per physical therapist. Physical therapists will perform all evaluations, reassessments, and discharges, along with treating patients when available. Physical therapy assistants are under the supervision of physical therapists and will perform treatments directed by physical therapists.
The total federal spending for the year 2015 is $3.8 trillion, and Medicare and Health accounts for 24.72% or $1.05 trillion. Social Security, unemployment, and labor accounts for 33.26% or $1.28 trillion. It is important to include this statistic due to the increase in Medicaid patients that are receiving home health care. In 2012, $78 billion were spent on home health services. Medicare and Medicaid accounted for 82% of home health spending, Medicare being 44% and Medicaid at 38%. Private health insurance accounted for 7%, out-of-pocket payment accounted for 8%, and other third-party payers accounted for 3%. In 2014, home health care accounted for 3% of national health expenditures. Physical therapists have been ranked as having one of the 10 happiest jobs by Forbes magazine. When polled, 75% of physical therapists reported being very satisfied with their career choice. In March 2015, the APTA announced that there has recently been an increase in physical therapy graduates. Due to the increased demand in health professionals, there is an increase in demand for physical therapists in the home health setting. Many new graduates are hesitant to work in home health due to not wanting to primarily work alone. Many of the patients that require home health services are not healthy or ambulatory, so new graduates are hesitant to start off in the home health setting. Home health care is a growing industry and has 35,000 companies across the country. The home health market is expected to continue to increase due to patients being discharged from the hospital earlier, an increase in the elderly population, and more conditions being treated in the home. As the baby boomer generation continues to age, the demand for physical therapists is on the rise. Currently, there are an estimated 21,000 home health physical therapists, which shows great hope for future employment rates. In order to receive coverage by Medicare for home health services, a doctor must certify that a patient is homebound. Many private insurance companies follow the same guidelines as Medicare when determining if a patient requires home health care. If a patient's insurance does cover home health, it is only for skilled, short-term, and medically necessary care. Medicare will pay home health care agencies a predetermined amount for care. The reimbursement can be adjusted based on health condition and needs of the patient. Home Health PPS will provide home health care agencies with Medicare reimbursement for each 60-day episode of care for the patient. Home Health Heroes will accept Medicare, Medicaid, and a variety of private insurances and self-pay as payment methods. This is a list of employment requirements. Home Health Heroes also requires all potential and current employees to undergo background checks, urine drug analysis, annual physicals, first aid, and CPR certification. Salaries for Home Health Hero employees will differ based on position and experience.
According to the APTA, the increase in graduates from PT education programs could help lower future workforce shortages. However, increased health insurance coverage nationwide will continue the demand for PTs. The Bureau of Labor Statistics reports the current high demand for PTs is expected to grow 36% by 2022. Though the demand varies by geographical region and area of practice, the unemployment rates are low across the country. Regarding home health PT, the service is expected to grow 47% by 2018. Currently, there are an estimated 21,000 home health PTs, which shows great hope for future employment rates. National data shows that over 60,000 children use home health services each year. Due to the continuous advancement of medicine and healthcare, the service options available through home health have increased. In the Pediatrics report, many researchers credit the growing popularity of home health to family preference. Many families prefer their children to be treated in the home setting and report lower costs of home health care compared to inpatient. Home Health Heroes treats a variety of pediatric patients with multiple comorbidities, severe intellectual and/or physical disabilities, or children who develop serious conditions as time progresses. According to the American Academy of Pediatrics, the 4 most common diagnoses are cerebral palsy, failure to thrive, developmental delay, and preterm birth. Each of our patients varies in terms of acuity and complexity, and the younger the patient is, the more likely they are to receive home-based care. To reach out to the general population, we run advertisements through the internet with a link to our website, the local newspaper, the local radio stations, and the local schools through flyers and bulletins. Market to other health providers, each employed PT is assigned a month to construct a marketing plan and put that idea into action. Home Health Heroes will also offer in-services and informative meetings on a quarterly basis. St. Louis County, persons under 5 years of age make up 5.8%, and persons under 18 years of age make up 22.3% of the population. Many home health agencies provide PT to the pediatric population in St. Louis County, therefore it is vital to continuously market and maintain relationships. Home Health Heroes and all employed PTs are licensed in the state of Missouri. Other requirements include a background check, urine drug testing, a yearly physical, and first aid and CPR certification. Home Health Heroes is accredited through the Community Health Accreditation Partner and Centers for Medicare and Medicaid Services.
The PT will be in charge of doing the initial evaluation, any reevaluations, and discharge summaries. They will make the clinical decisions if the plan of care changes pertaining to the patient. The PTA will be allowed to conduct treatments and work under the supervision of the PT. They can be able to contact the PT through telephone if the PT is off-site. Home Health Heroes' main office hours and treatment hours will be Monday through Friday, 8 a.m. to 6 p.m. Therapists will treat 6 to 8 patients a day, allowing for 60 to 90 minutes for evaluations, 45 to 60 minutes for subsequent treatments. They will be in charge of calling their patient load each day ahead of time in order to give them an estimated time of arrival for the treatment time. It is encouraged to notify the therapist beforehand if they plan to cancel or not be home for a scheduled treatment time. Patients will be removed from the schedule if they cancel or no-show 3 times. Therapy will be done at the patient's discretion if they refuse the therapy treatment. We will notify the referring physician about the patient's decision to not follow through with therapy. Hard copies will be stored at the office in safe, locked cabinets. Patient notes, evaluations, and reevaluations will be typed on the password-protected laptop, which is connected to a secure server.
Our skilled home health center provides superior and empathetic care to all of our pediatric patients in their homes. There will not be an outpatient treatment facility in order to provide timely, high-quality, cost-effective care to the patients. It is of most importance that our patients receive the best experience when being treated by our medical professionals. Each therapist will provide evidence-based interventions and wellness programs implemented in the community. We will speed up recovery time while promoting independence and overall health. It is our goal to improve each child's quality of life. Thus, we will increase the patient's physical activity to reduce body mass, improve health status, and reduce chronic disease risks. For each patient seen, the therapist will bring the equipment needed, such as free weights, resistance bands, and others needed. Therapists will bring computer for documentation and a plinth for the session. All therapists will be equipped with blood pressure cuffs, pulse oximeters, and stethoscopes in order to assess the patient's vital signs. Each therapist is required to provide their own transportation. However, they will be reimbursed for gas and other expenses through the company. We will provide truly patient-centered care while helping regain independence in the home. We will improve mobility, relieve pain, and prevent permanent disabilities. We will help patients restore function while helping them recover sooner. By being able to come to the home, greater compliance is met with an increase in physical activity for the future. It is easier to stay involved in patient treatments, as well as being able to fit the treatment to each individual's lifestyle. Patient education will be given to parents and children, and they will be taught about safety issues, and the caregivers will be taught how to help their children in the home. We will prevent further health complications and hospitalizations while promoting health and wellness recommendations, and our patients will be more comfortable in the familiar surroundings and family support. The company will be able to reduce medical costs without compromising the quality of care for our patients. We'll be obtaining referrals from various clinicians such as physicians, physician's assistants, and nurse practitioners. Settings we are accepting from are acute care, long-term facilities, and private practice offices. Another way we'll get our name out is through marketing. We'll use the postal service by mailing out letters. We will also become a part of companies in which provide home health services, such as with nurses and physical therapists. The nurses will help determine if the patients need physical therapy, and thus we will obtain referrals from the doctor.
Home Health Heroes will be legally compliant with OSHA and HIPAA guidelines. They will follow universal precautions when necessary. All will be CPR certified, require background checks, and random drug screenings. Employees must complete annual compliance classes in order to avoid penalties. These classes include HIPAA, fire safety, identification of abuse, infectious disease control, and a body mechanics workshop. Every employee must complete the online class in order to ensure competence with patient care.
Documentation is a vital component of physical therapy. and it is especially important in the home health setting because during visits, the therapist does not have quick access to additional staff. Documentation needs to be detailed and clear in order for the therapist to follow the plan of care established for the patient and to be aware of any precautions for that particular patient. To promote accuracy, proficiency, and timeliness, all documentation for that day must be completed by the end of the day, and mandatory peer reviews will be conducted once a month. Not only is documentation a major aspect of communication between the therapist, it is a major component when dealing with insurance and legalities. To stay in accordance with HIPAA and privacy policies, all documentation will be done using the company-issued computers. The computers will be kept in a lockbox in the home office when not in use. They will be picked up in the morning and then dropped off at the end of the day. Along with documentation, communication is vital in the healthcare setting. Home health is a unique structure where therapists are relatively on their own, and so it is imperative that communication is efficient. To promote this higher level of communication, Home Health Heroes will hold weekly company-wide meetings to discuss delivery of care, compliance with policies and procedures, as well as any other concerns brought to attention. Communication will further be facilitated by allowing employees to carry a cell phone on them at all times, and the supervisor and director of physical therapy will be available by phone at the home office. A mentorship program is also available to all new employees. The mentor and new employee must meet at least once a week and meet once a month with the director of physical therapy. There are many inherent risks in the home health setting due to the setting being highly variable, non-institutional, and relatively uncontrolled. Home Health Heroes takes numerous measures to ensure safety. Potential risks include hazard risks. To manage hazard risks, employees are required to be trained in and abide by OSHA safety standards and follow universal precautions and any other safety procedures deemed necessary by management. Home assessments will be completed at the initial evaluation to prevent injury and assess for any potential hazards. Appropriate insurance is also required, including car insurance for the traveling therapist. Other risks include operations risk and human capital risk. To manage operations risk, clinical equipment will be inspected daily and disinfected after each use. Employees will be CPR and first aid certified with renewal kept up to date. Therapist CEUs and licensure must also be kept up to date. Documentation must be accurate and thorough, including filling out incident and accident reports when necessary. Lastly, to manage human capital risk, standardized hiring and firing policies are set in place, and prolonged therapist absences will be filled through a contracted temp agency to ensure that there is an adequate number of therapists on staff at all times. Home Health Heroes strives to provide the best care, and ways to assess this are through utilization review and outcome measures. Utilization review is used to safeguard against unnecessary and inappropriate medical care. Home Health Heroes will contract third-party administrators to evaluate services and care provided by the therapists. Utilization techniques that apply to physical therapy include prospective review, concurrent review, and retrospective review. Prospective review is used as pre-certification for recommended procedures and to determine whether the recommended treatment is appropriate. Concurrent review involves the assessment of ongoing treatment. And lastly, retrospective review, which is the least desirable type of review, involves a review of medical information that was present at the time the initial decision was made. Along with utilization reviews, Home Health Heroes will use outcome measures to ensure we are providing the utmost quality of care to our patients. Surveys will be used to assess patient satisfaction, quality of care, and any concerns our patients may have.
It's done, boss.
Good work, Parker. You better not have let me down.
Here with the